Hello and welcome to Fit After 40. I'm Chris here with Tony, and our guest today is Dr. Carey Heller. Dr. Heller is a specialist in adult ADHD. Welcome to the show.
Yeah, it's great to be here. Thanks all for having me.
Thank you. So, why don't we start with just a little bit about yourself? Just tell us a little bit about your background, a little bit about your work. Just give us some context.
Sure. So I'm a licensed psychologist. I'm based in Maryland, right outside of DC in Bethesda. I specialize in ADHD and executive functioning issues, which I'll talk about, I'm sure, in more depth later and explain. But basically,
Absolutely.
I help people with time management, organization, planning, and these things are vital to people pretty much of all ages, but especially, in adulthood, as you get, later on, sort of, just sort of, into 40s and beyond, they, in some ways become even more important. So
Sure.
it's certainly, definitely an important area I have a lot of fun with and really enjoy helping people to really thrive, improving efficiency and time
Mhm.
management.
Yeah, and I'm sure as people enter middle age, we've got a lot more plates spinning, and focus becomes really critical. And I would think maybe underdiagnosed attention deficit would become these symptoms might become more problematic. What inspired your focus on this? What made you want to move this direction with your practice?
I don't know. I feel like I've been interested in ADHD for a long time. I think even, and I did some internships at NIH in college and then, grad school, I, encountered it quite a bit. And I think what always sort of stood out to me is this, it's something that I think people often think only is in childhood,
Right.
which is
Yeah.
not true at all because it definitely impacts adults. And there are a lot of adults that, if you look back at history, probably had this, all the symptoms are all there, but people didn't notice it when someone was a kid. But I think it's something that, I think on some level has been destigmatized to some degree, but it's still there. But I think people don't really understand it and really don't fully get how much of an impact it can have on someone's life and how much better someone can be by, receiving treatment and work on strategies to really make things better. So I think just this, the benefit of wanting to sort of help people to be able to really thrive in life.
Hmm.
I think really sort of what got me interested is has kept me interested in
Sure.
ADHD and executive functioning issues.
Before we get into symptoms and coping strategies, let's start with some definitions. ADHD stands for Attention Deficit Hyperactivity Disorder. How do you define that, and what is executive function, and how are these related?
Sure, it's a good question. Definitely important to start with that. So basically ADHD, it's a disorder there's the DSM-5 TR. It's the manual that's used as a criteria for different mental disorders. And so it's classified as what's called a neurodevelopmental disorder, which basically means that the symptoms typically are supposed to have started in childhood. I'm just mentioning that because the idea
Sure.
is that even if the symptoms you first notice in adulthood, technically they have to have been there in childhood in some capacity in order to sort of receive a formal diagnosis. But
Hmm.
basically, it's a disorder that impacts self-regulation. So self-regulation of attention, movements, of fidgeting. But basically, it impacts how well people can stay focused, get started on things, finishing things, sitting still. And for adults, that often can come into play more of inner restlessness, not as much of what you think about a child bouncing off the walls. For adults, certainly
Right.
adults can fidget, but it can often be
Yeah.
a lot of more like inner restless, like a sense of like needing to get up a lot. I feel like it's just sort of really
Sure.
antsy.
So, I work at a desk a lot, and every hour or so I get up and take a short walk or go get a glass of water or something just to break up the monotony. How do you distinguish that kind of habit with something that is more of a disorder?
Well, I think with anything, it's really a matter of, what are the actual symptoms in the first place?
Hmm.
What's, fairly normal? It's healthy to get up every, 30 minutes to an hour to begin with.
Yeah.
So, and most people can't really stay optimally focused for more than probably 30 to 45 minutes anyway.
Sure.
So I think you have to look at sort of what's sort of fairly typical and for when there's any sort of issue, how much of a functional impact is it having on day-to-day life,
Okay.
but also not just in one domain. So not just, let's say, in work, but in family life and other things as well. So that's sort of part of it. And then you mentioned or asked earlier about executive functioning. So executive
Hmm.
functioning, basically, think about it like the control center of the brain. It's basically the skill set that helps with planning, organizing, getting started with things, finishing tasks. Pretty much you need executive functioning skills to function in life.
Mm.
You're not gonna remember to even look at your calendar to see what you have to do if you're not keeping track. So you have to hold stuff in your mind.
Yeah.
And it's basically, or think about like the control center of a factory. That there's all these different pieces that work together. Let's say, I don't know, put together a car in a car factory. And basically, so executive functioning is sort of this the skill sets involved in your mind that help you to really be successful at getting anything done.
Thank you. Yeah, that's really interesting. Let's dig into the symptoms now. Next. So, what symptoms should we be watching for? Of course, you said, of course, inability to focus is fundamental, but how does that manifest? What should we as on an individual basis be monitoring for?
Sure. So there are a couple of things. So there's, trouble staying focused on things that you need to do.
Hmm.
The thing that's really important to keep in mind, and people don't always realize ADHD, is because it's sort of a disorder of struggle with kind of self-regulation of attention. People with ADHD can focus quite well on things that they really enjoy. So
Okay.
it's not just about focus itself, but it's and in some ways they can actually hyper focus, which means to focus, sort of more intensely for a longer period of time on things that they really enjoy. But it's the things that you sort of have to that you don't really like doing or that you find really boring that are so those are the things to really watch for. Then, of course, most people are not going to be as interested in something if it's not as interesting to them or they don't like it. But with people without ADHD are more easily able to get themselves to sit and do the things that they need to do, even if they don't want to. Whereas ADHD it makes it substantially harder. So
Hmm.
looking at the attention piece, the ability to sit still, if you have even an adult is constantly shaking their leg and shaking the dinner table, or
Hmm.
you have a person that's constantly fiddling with things, tapping their fingers on the desk during a meeting, those kinds of things, certainly could be signs of ADHD. It's a sign of
Hmm.
fidgeting, but again,
Right.
anxiety can impact that. I mean, there are a lot of different disorders that have similar or some overlapping symptoms. So I would watch
Yeah.
for that. The other big thing I would really look at with attention is when someone zones out to look at what happens. Does the time just suddenly disappear? Are they thinking about something that's bothering them? So if most of the time when someone loses focus, their mind keeps going to things that they're worrying about or that are really bothering them, there's certainly more of a chance that there's something around anxiety or depression or something else, going on because that's where
Okay.
their mind goes to and that's why they're getting distracted. If
Sure.
like suddenly they look up and half hour's gone by and they've absolutely no idea what happened,
Hmm.
or if their mind just keeps, I don't know, focusing on random things that aren't really upsetting, but are just sort of random, certainly that could be more of a sign of ADHD. Again, that's not a be all and end all in terms of differentiating, but that's
Mm.
one thing I find my practice really helpful as a starting point in trying to differentiate what's going on when there's a lapse in attention and what might be the cause of that.
Are there like biological markers of ADHD versus environmental markers? Do we know what causes ADHD to occur biologically in a human being, or is that more something that's influenced by environment and or a
Yeah.
mixture of both?
Is it video games or is it genetics,
Yeah.
Yeah,
Like,
Yeah.
yeah,
I mean, so I can answer that to some degree. I mean, part of the reason I can't answer that very specifically is we don't know for sure for certain
right.
stuff.
Yeah.
yeah,
The
Research is
idea
ongoing.
behind it is, I mean, it's not something that's caused by environmental factors directly. I mean,
Okay.
it's a biological disorder by nature, but the expression of symptoms can really vary. And so, if you have, for example, think about an adult that if someone let's say has ADHD, if they're in a job where it's a really good fit for them, they don't they have a lot of stuff given to them, they don't have to plan a whole lot themselves. It's really interesting. They're very creative. Sort of if it's a really good fit, the symptoms may not manifest that as much at work. If they're in an
yeah,
environment where they have to sit at a desk all day, they're doing a bunch of boring tasks, they have, a lot of deadlines, and, they can't plan, they have a hard time, managing any sort of stress related to it, they're constantly being flooded with new things, they just don't know where to even begin half the time, then they're probably gonna have a lot more trouble.
Hmm.
mhm.
So while the environment definitely can play a large role in sort of bringing out the symptoms and seeing how much they manifest, it's not the environmental factors don't directly cause ADHD.
Okay. Do you think that the symptoms are exacerbated by our very stimulating culture? I mean, we all
Yeah.
have a dopamine device in our pocket. We could scroll on TikTok and watch funny videos for hours. I mean, you were speaking earlier about losing awareness of the passage of time. That I believe the term is time blindness. Is that correct?
Yeah, time blindness. Yeah, if we're kind of losing track of time or not having sense.
Do you think these devices and this culture that is designed to be so stimulating, do you think that's exacerbating these symptoms?
Yeah, I mean, I think for a lot of people it certainly can be. Again, it's not bad. It's not causing ADHD, at
Hmm.
least in my opinion. But I do think
Yeah.
that certainly it's not helping things. I mean, because if you think about some of the social media platforms, and again, some of them now have requirements of having at least an option to set a timer after a certain period of time, but a lot of them will
Sure.
hide the time. So, and it's endless scrolling.
Yeah.
So it's very easy to kind of get sucked into it. because there's no like set endpoint of, oh, I should disconnect. Like
Right.
even like with Netflix, for example, when you watch a TV show, usually like it'll pop on to the next thing, especially a TV show, it'll pop on to the next thing after.
Right.
And so, but there's still that element of, oh, this episode's over. Let me at least think for a sec.
Right.
Should I disconnect, or do I have time for another episode? But when
Some
there's no
partition.
sort of barrier to even get you to think, should I stop what I'm doing? It's much harder because one thing with ADHD that can be very challenging is to shift attention from one thing to another. So that's
Okay.
why it can be really challenging to get up from what you're doing to switch to then go to the next thing you're supposed to be doing. And that's where people lose a
Yeah.
lot of time as well.
You've kind of referenced impulsivity. How does that tie in?
Sure. I mean, so they can manifest in a couple of ways. There's, the impulsivity around taking actions. So, for example, impulsive spending, just thinking, oh, I
Oh,
want this, let me buy it without really thinking
finances.
about, yeah, so the financial piece, like thinking about just getting stuff because you want it without really thinking about what are the ramifications. There's, aspect of diet. So impulsively thinking, oh, let me eat this ice cream, even though, it's really not healthy, or I've already had tons of, sugar today. So, so
Right.
there's impulsivity around the actions. There's impulsivity in what you say. Like that I see quite a bit where it becomes an issue, with friends, with significant others, with kids, where people sort of react impulsively by saying things that they probably shouldn't say. And or I've seen it also can be a big issue in the work environment as well, that
Mm,
not really having a filter in a sense. And so saying kind of what you think without really thinking about how might this go over to the other person.
sure.
What about addiction? Does addiction play a role in ADHD?
Yeah, I mean, it certainly can. I mean, there's a lot of research that's looked at different aspects of it. I mean, what's interesting is, a fair amount of studies have shown that, well-controlled ADHD, even with stimulant medication, for example, can, in a lot of cases, often actually reduce the likelihood of addictions because people aren't creating that stimulation quite the same way as they were if the ADHD is completely, unregulated,
Mhm.
because people often worry about some medication being addicting. I mean, obviously, I'm not a psychiatrist; I can't give formal sort of advice on medication. But but
Sure.
in general, the better controlled symptoms are probably the least likely someone would be to develop an addiction. But again, people can still be very addicted to stuff even if ADHD is well controlled. But I think
Hmm.
it probably makes
Okay.
it at least a little bit harder to and also people may be less likely to put themselves in that situation in the first place, like especially with certain substances that they impulsively try and then suddenly get addicted.
So you mentioned impulsive spending and impulsive eating. So these would be flags that people would look for if someone has trouble regulating their diet, if they can't say no to that second piece of cake, or impulse purchases that result in maybe large credit card debt, living beyond your means. Would these be kind of secondary or tertiary symptoms?
Yeah, I think they definitely would be. I mean, there's certainly things I see quite a bit and would be sort of things that, I mean, in general, they're each of them by themselves are still an issue. And
Right.
anytime there's an issue, it would be good to ideally address it.
Yeah, of
But yeah,
course.
altogether, certainly it's, definitely a common signs of ADHD that, are definitely, but again, anxiety can cause, people to sort of do stuff as a way to cope. So there, the idea is like, regardless of what you think the issue is, if there is an issue, reaching out to the right professional to try to make these things better is really most important.
And again here, of course, these are symptoms that we all experience to some extent. I mean, we've all made an impulse purchase. We've all had a second slice of cake that we probably shouldn't have. But when it crosses into a diagnosable issue, kind of a pathology, is when it is impacting the rest of your life. When it's not just that piece of cake you shouldn't have, but you've crossed over into a very unhealthy diet, or it's not just that you bought that one thing that you shouldn't have. It's I've got $15,000 in credit card debt. I need to put a stop to this, and I'm still adding to cart.
Right, exactly. And again, I think with that, some of it can be impulsive spending, some of it is sort of a lack of awareness of how to budget or how to plan, or the
Hmm.
idea of not really, because one thing that's going to be hard sometimes is not always really seeing the consequences in the moment. So the idea of,
Sure.
doing something, which again is, certain impulsivity, but it also gets that sort of challenge with planning too.
How often do you see these types of mental disorders, ADHD, and then things like, of course, you mentioned anxiety, you mentioned depression, sleep issues. It's a hot topic right now. A lot of people are really working on their sleep. It ties into so much of your health. How often do you see these co-occurring?
Quite a bit. I mean, I don't know the exact statistics, and I'm sure, I
Hmm.
think when you look online, there's definitely some variability in the rates, but again, I think it
Sure.
can be fairly high. what's hard to figure out sometimes is, are the disorders sort of just both happen to be there, or is it that, over a long period of time, challenges with ADHD have maybe contributed to the development of anxiety or depression. So like
Right.
that's also, can
Hmm.
certainly occur quite a bit. So it's, the idea is by sort of having the ADHD sort of better managed, you're certainly less likely to experience other things. Or if you do, it means then that you can know what's actually ADHD versus anxiety to then target a treatment
Sure.
more effectively.
Gotcha. And would these, like, let's take anxiety or and depression specifically, would these conditions would they complicate treatment? Would they make it more would they make things harder to diagnose? How do they interact?
Um, I mean, certainly, I think there are a lot of times where it becomes harder to sort of, to look at sort of what's actually going on. Like there are a lot of times where, I've had people that come to me and have, reported that they've had a long history of anxiety. They've gone to lots of therapists and tried to work on it, but that someone finally realized, oh wait, maybe it's actually ADHD and not just anxiety. So I think the problem is sometimes, things can get missed with it being ADHD because if there's a lot of other symptoms, that sort
Right.
of, cover it. Or same thing with OCD.
So a lot of symptoms are common across multiple disorders, and it can cause issues with diagnosing. Is that what I'm hearing?
Right. So that definitely can make diagnosing definitely more challenging.
Sure.
And again, there's also the fact of, not all providers, are extremely knowledgeable at ADHD. Like most people, theoretically should have at least a working knowledge of it. But, I think there are definitely some clinicians that it's not really a primary focus for them. So,
Hmm.
they know the real basics, but maybe don't necessarily know, certain signs to really sort of look at.
Hmm.
So if an individual suspects that they may have these symptoms crossing into a pathology, your recommendation is to see a specialist who is a specialist in ADHD specifically.
Yeah, I mean, I think that definitely can be very helpful. I mean, my suggestion would be whoever, someone's working with, let's say a therapist at the time, to bring up the
Mhm.
concerns to the therapist, let them, evaluate, get their input, because, presumably if
Yeah.
they have training and they're, licensed, they should be able to at least recognize, oh, this actually could be
Right.
this. If I don't feel competent to be able to sort of make this diagnosis or further evaluate, let me at least help refer you to someone who would.
Sure.
But I think starting with whoever they're working with as a starting point, I think would be good. Same thing with even just talking to a primary care doctor, during a checkup if someone has concerns about ADHD.
Absolutely. Now, of course, if someone has extreme symptoms, I imagine that if medication is indicated, you would refer them to a psychiatrist at that time, and your therapy would mainly focus on coping strategies and behavioral modification. Am I right?
Yeah, I mean, so as a psychologist, I don't prescribe medication, and other
Right.
than in
Yeah.
most states, psychologists cannot prescribe medication.
Right.
I mean, I'm somewhat unique in what I do, and that basically, as a psychologist, I do both sort of typical therapy as well as ADHD and executive function coaching. So I definitely take like a more sort of practical approach towards planning out tasks. Looking at setting up specific things around physical organization, like helping to organize their desks, and all sorts, and looking at morning routines, evening routines, and so there's certainly a lot of ADHD and executive function coaches that do that. And, but, there are not as many people that do sort of the therapy, just the emotional piece as well. Because, both of them are really important. But I'm just mentioning that because when people look for someone to work with, while I'm sure the occasional other person that's like me that does both as a mental health professional,
Right.
not that common. So a lot of times
Yeah.
people end up sort of seeing a therapist for more of the sort of the emotional piece. And then sort of a coach to look on, the nuts and bolts and the practical aspects of things.
Right. Well, let's move on to strategies then, coping strategies. Why don't we start with kind of the self-help strategies? If someone has mild symptoms, maybe they're not working with a therapist currently, maybe you could lay out some strategies just to help people organize their lives. And I obviously this need not be limited to people who have a diagnosis. I think a lot of people could use some help with organizational skills and coping with these types of symptoms. So where do you start with these with managing these symptoms?
Sure. I mean, it's a good question. Obviously, there's a lot. I mean, I could probably talk for hours on this, but
Sure.
Yeah.
trying to sort of keep it simple, and looking at things. I mean, first of all, just from a mindset perspective, the idea within reason, the idea of always thinking, how can I improve? Like as long as that doesn't become problematic to someone, like that kind of mindset helps you to continually evaluate what's working, what's not. Because you don't, unless things are going terribly, most people are not going to frequently evaluate, are the systems I'm using working, or could I do better? So just, having being
Yeah.
open to that continual evaluation is really important. In terms of where to start, I mean, a lot of times what I say for adults is to sort of look at how are you keeping track of tasks? Because that often seems to be one of the areas where the challenges often lie to start is not necessarily being able to keep track of stuff, or being able to keep track of stuff but being so stressed out by all you have to do that you're not getting stuff done. So first looking at it from a perspective of having a master task list.
Okay.
You'll have, one place where all the different tasks, and some people doing it, having one for work and one for personal stuff can work well. For others, having it all together works well too. So I think it depends on the person. But basically having a master task list of everything. What I would say with this is, I know some people prefer paper, some people prefer electronic. I do think for the master list, especially for long-term stuff, doing it electronically, at least from my perspective, is often better, because otherwise you have to keep rewriting stuff. And I think it's much easier to keep track of longer-term stuff electronically. So, task lists can be great, like for example, like Todoist, TickTick, Asana. Those are, a couple examples of, task list programs that you could use to keep track of things. And, next big thing, so after you sort of have like your master list of everything, is to actually plan it out. Because it's great to have a bunch of tasks in a list, but they're not going to magically get done because they're in a list.
Right.
So that's where figuring out the idea of basically having a set day and time to work on each task in the list, but to be realistic about it. So one of the things you have to figure out with a task is how long might it take to complete, or for bigger tasks, breaking it down into parts. And so a lot of the task list programs allow you to create subtasks. So like, let's say, I don't know, you have to organize, I don't know, a shed, for example. So maybe you break it down into parts and to look at, what are different things I need to do? So maybe the first step is, I don't know, get all the trash out of there. The next step is to figure out what other shelving do I need to make it better organized. Maybe the third step is to take everything out. And the fourth step is to put it back in an appropriate place. For people that have a hard time with that planning piece, because for a lot of people that can be challenging. One idea would be, there's a program called Goblin Tools that you can use to it uses AI basically, where you put in general tasks and it basically breaks down tasks into parts for you. And it has like a pepper thing where you can control, based on the number of peppers, how many or how detail oriented it is in terms of being broken down. And it has a thing where it'll tell you an estimate of how long it should take to do each step. Again, it's not perfect, but for, if you get stuck, it's a really good way to start.
Yeah.
I mean, you probably could do a lot of that with
start.
ChatGPT as well.
Sure.
But, this program is, definitely more specialized for the planning piece.
Yeah.
What is that called again? Goblin tasks?
It's called Goblin, Goblin tools.
Tony's writing that down in his 1982 Moleskine notebook. Which is his
that's
task
actually
list.
Yeah, this is so I actually was thinking that's exactly because I feel like I'm an undiagnosed exhibit a lot of these symptoms. So the way I manage my issues is I use a Moleskine calendar. I write down every task I have to do that week on one side, and then on the other side there's the dates, and I put the date. Then I break them down on the other side by dates, and then I check them off as I go. That's how my weeks work.
Well, and again, if that system works well for you, that's great. I mean, because I think the big thing here too is everyone's different. Everyone processes information differently and views things differently. And so, just because a system works well for one person doesn't mean the same system is going to work well for another person. So it's really important to look at, what works for you. And also, if things aren't working the way you want them to, in general, if you can, it's often better to make as minor tweaks as possible to get what you want, rather than trying to drastically overhaul things. Because it'll be much easier to implement a system if it's as similar to your current system as possible, but just maybe a more improved version of it.
Yeah, optimize it. It's funny because Tony writes everything down pen and paper. With me, it's 100% electronic. If it's not in my calendar or my notes on my devices, it's gone. It won't stay in my head. So
yeah. Well, and I think an interesting point about that is, like, as weird as it sounds, I often tell people, don't trust your memory for tasks. Rely on writing it down, because the problem is your memory is not going to be 100% perfect, and it may not remind you at the right time when you need to do it. But if it's written down and you have an electronic reminder, you're more likely, you may choose to ignore the reminder, but as long as you see the reminder, you've been reminded of the task you need to do.
Reminds me of I think it was one of Plato's writings, but through Socrates was lamenting that all of the Athenian youth were destroying their memories by writing everything down. It was just wrecking their ability to recall, just lamenting the loss of those memories.
Yeah.
But obviously, we could store a lot more
Yeah.
information
Right, and it's
writing
different.
it
Like I
down.
think, I mean, obviously, there's a lot of benefits of having a good memory, but also if you think about
Sure,
how taxing it is to keep track of all the stuff you have to do, basically it
very
frees up your
stressful.
memory for
Yeah.
other things, and also in most cases can often reduce stress by not having to keep track of as much and seeing it planned out for you. So I think, getting back to kind of the system. So I think having, the basically you have the master list of everything, then you have kind of a daily plan. And so in the apps like Todoist or TickTick, basically by having a set day and time for each task, and also allocating a specific amount of time to it based on how long the task would take, then you either put that in the program. Some of the programs will connect with the calendar, so they'll automatically put it into the calendar for you. Because the other problem is you have to figure out when are you actually free to do stuff. So this is where the calendar comes in. Then you have the task
Right.
list for the tasks, but you also have to allocate time to get the tasks done. And so
Yeah.
that's where, blocking out time in your calendar, either for those tasks or for like a group of, let's say administrative tasks, and then have it itemized in the to-do list of during this time, these are the things you're going to get done, can be very helpful towards being better organized. And, also being mindful of time, like looking at, what time of day are you likely to be freshest to do certain things.
Yeah.
So paying attention to sort of
That's
your
a good
energy
point.
level, things like that. Also looking at, are you someone that does well with lots of blocks of time free, or are you going to waste a lot of time if you have 3 hours, but if you have half hour, you're going to be far more productive in that half hour.
Hmm.
So I think,
That's
those
really
are
interesting.
other things that are important to do. And if people get stuck with the planning, I mean, in terms of other like ways to get help. So there's a program called Sunsama, Sunsama. Basically, you can use it by itself or integrate it with a lot of programs. Like I believe it integrates, I think with Outlook, it definitely integrates with Todoist and some others.
Okay.
But basically, it kind of prompts you like of the tasks you have listed, and then allows you to drag and drop tasks to a certain day and time in a calendar. And so it kind of does things that I think, some people use long term, but I think it can be a really great way to train yourself how to plan to use it as a short term option. But again, some people use long term and that can work well too. So that's another one. There's also, I actually created a program a couple months ago called ADHD Assist. It's basically an AI program that specifically is, geared towards helping people plan out tasks and also reducing the stress associated with it. So basically it's programmed to, have you be able to kind of, you can basically, depending on how you have your tasks listed, you can just, throw them out, type them in, or you can upload, if you have a document with them or a picture, and then it'll, may ask you a few questions based on how much information you put in, but basically guides you on how to plan stuff out. And so the idea behind it is that, it helps when you get unstuck in the moment, but it also teaches you how to plan yourself long term as well.
So at what point should someone begin to consider, someone is trying these self-help steps, these strategies. At what point should they consider therapy or coaching? And maybe we could distinguish between therapy and coaching, or do you use those interchangeably?
Sure. Yeah, no, I can definitely answer those questions. So, I mean, the first thing is if you try some of these strategies and you don't feel like you're getting what you want out of it, then it is definitely beneficial to meet with a professional because, one of the things I often hear from people is the idea that, I've tried a million apps and none of them work.
Yeah.
Right.
At some point, a lot of apps are pretty similar. And so, in that case, it may not necessarily be just the app that's not working.
Right.
That it's, often sort of how someone uses the app that ends up sort of being the bigger issue, since most task lists are fairly similar, or at least somewhat similar in how they're set up. And so the idea, though, also is by looking at someone as an individual person and looking at it comprehensively, not just, here's one task or here's one strategy for this thing, by looking at it like all together, that can really help towards, creating a comprehensive plan that will work better. So I think being able to meet with a professional for that, could definitely be very helpful. It also creates accountability.
Yeah.
As far as like the difference between coaching and therapy goes, so basically, coaching is not, for most cases, not really a regulated. Well, so there's certain kinds of coaching, like there's life coaching there's a certification, ADHD coaching. There is technically a certification that people can get. Executive function coaching is not really, there's not really a formal certification process. So people that, offer themselves as coaches don't necessarily have formal credentials, or it's sort of, variable in what any credentials they have are necessarily. But, if you're a mental health professional, you usually have to be licensed.
Right.
And so that's one distinction in looking at difference between a coach and a therapist. So in a lot of cases, it's really important to look at someone's background and experience, especially for coaching. But for therapy, it's more, looking at it from a perspective, you're looking at it from a perspective, treating specific mental health disorders and,
Right.
addressing a variety of issues. Coaching is more of a, often more strategy based,
Sure.
but you're not
Okay.
necessarily targeting direct, anxiety or depression. It's,
Right.
more sort of other things that don't really have a formal label.
Targeting symptoms in some
Right.
cases. Like we're having a problem with this specific thing, so we're going to establish a strategy absent a diagnosis.
Right. Exactly. Yeah. So it's about that
Okay.
without any sort of formal diagnosis.
Mm-hmm.
I'd like to just jump back one step back. I know we moved on from coping strategies, but something we talked about was you talked about time blindness, or I don't know, maybe it's just me, but who hasn't gotten in like a stuck on TikTok, and then you look up and it's
Yeah.
like 3 hours later, and you're like, oh my God, what happened to the day? Or like maybe you're doing that because you're just paralyzed because what you have to do that day is so overwhelming. So you kind of get sick. What are strategies from getting unstuck from those situations, I guess?
Sure. I mean, there are, a variety of different things you could do. I mean, one thing would be, first of all, to figure out a way to be able to be aware of the time. So, for example, if before you, open up TikTok, set a timer on your phone for a certain period of time, or an alarm.
Sure.
So the
Yeah.
idea is that if you say, I'm going to take a 10-minute break, have the alarm go off after 10 minutes. So even if you're engrossed in TikTok, you get the alarm that goes off. So it gets your attention that, oh, a certain amount of time has passed. And then you can
Yeah.
set a backup alarm as well. So this way, the idea is that that's certainly a little more likely to prevent you from, getting sucked in for as long, because at least you're aware of the time. Some of
Right.
it also again, it depends on TikTok. I know a lot of videos tend to be shorter, but, depending on how long the break you want to take and how long the video is, look at that. Like same thing with YouTube. If you're going to take
Yeah.
a 5-minute break, don't open up an 8-minute video.
Yeah. Good point.
So I think just
Right.
being aware of, and the same thing with thinking about what is your expectation when it's time to disconnect. Because this comes up a lot, sort of for those of you, listening that are parents, the kids that are very attached to technology, looking at perspective, when you say time's up on the iPad, to look at it from perspective of what's their expectation. Is their expectation that when the time, hits whatever the time is up time, that, they immediately close it and disconnect? Or is their impression, oh, that means I should start wrapping up in the maybe the next couple minutes?
Right.
So understanding what is the expectation. So when the timer goes off and it's time to stop, is your expectation that you should immediately stop, or is it that means it's your time to start wrapping up then? Other things you can get are you can do
Okay.
a visual timer. So there's one like called time timer.
Okay.
Now this is nice because it doesn't involve technology really. I mean, they do have an app version, but I don't know if you can see with the
Yeah. Yeah.
Yeah.
Just
Yeah.
just an old-fashioned timer, just like a
yeah,
like
it's
a
visual,
like a
though.
big
So
stopwatch.
it also helps with understanding time better because you see sort of the time in numbers rather than digitally.
Right.
There's also a program called 360 Thinking that's kind of like the time timer I showed you, but it's an actual clock. And so it has like I think like the yellow phase is like the beginning phase, like the green is the main part, and then there's like a couple minutes at the end that's the red. It's 100, so it signals you when it's time to start wrapping up what you're doing.
Mhm.
So when you are engaged, when you're working with a patient as a therapist, which types of therapy have you found to be most effective?
I mean, it really depends what you're trying to target.
Okay.
I mean, the way that I approach things is, I mean, I certainly use a fair amount of cognitive behavioral tools. Like I think on the surface that can be very helpful, certainly short term, but at the same time, understanding like what's going on underneath the surface, like what's the deep rooted sort of issue and how's that impacting things. So often using a psychodynamic approach can often be really helpful at the same time for longer term change as well.
Gotcha.
Explain what a psychodynamic approach is. I'm sorry, I'm not.
Oh, sure. It's more of kind of looking at it sort of loosely evolved. I mean, it's not exactly Freud, but it's the idea of really understanding like someone like on a deeper level of understanding, how do they function? Like what triggers them? What makes them kind of
Yeah.
how did they evolve into sort of the person that they are today?
Mhm.
Okay.
And CBT, do you mind defining that before we move on?
Sure, cognitive behavioral therapy. So basically, it looks a lot more at kind of like, let's say you have a thought that pops in your head. So the idea of looking at, what triggered that thought and how can you maybe reframe that thought or change it in some way. So it looks at sort of actions and behaviors and thoughts, and basically looking at how do you sort of adjust. So like for short term to sort of make things better, it often can be very helpful because you're looking at sort of, here's not exactly a quick fix, but this idea if you can learn the strategies, it can be very helpful. One of the problems though to keep in mind with ADHD is that oftentimes the follow through is really challenging. So like for any, like, because a lot of CBT therapies, not all, but a fair amount have homework associated with them. So,
Okay.
but the ability to follow through on doing the homework can be challenging with ADHD.
Yeah, especially people with extreme symptoms, I would think.
Right. And so that's something that I think in general is important to keep in mind that, even if you have other issues that are going on, that's where having a clinician that really is aware of the ADHD piece, and either knows how to help you with it or, collaborates with someone else, to help you with that part of it really can help make other treatments more effective also.
So it seems to me like this is, ADHD is very much a hot topic now. I think that we see it, we see it in the news, we see it in social media, we see people self-diagnosing this,
Very much so.
and we all have some fear that we exhibit the signs of it, obviously, I think to some degree. How do we know, like, how do you know you need to go seek help, I suppose?
I think it really comes down to looking at formal criteria, like referred to as what's called clinically significant impairment. Basically,
Yeah,
is it impacting your daily functioning?
yeah,
And would you be better off if it didn't impact it? Like, is it
Right.
impacting your finances? Is it impacting your relationships with people? Is it impacting your work performance? Is it impacting your career trajectory? If you're not getting promotions, for example, because of sort of not being good at deadlines, obviously long term that can probably have quite a bit in the way of ramifications in terms of career growth, income, things like that. But even just thinking about how much is it impacting self-esteem? Is it making anxiety worse because you're always worried that you're going to miss a deadline? Is it
Oh,
causing,
wow.
issues with significant other because they're hounding you to take out the trash that you always forget to take out? Like there are
Right.
all these sort of different sort of facets of it that people don't always think about. And again, there's some people, a lot of people with ADHD that, are essentially are very high functioning, that they get by quite well and do day-to-day stuff, and there may be sort of little cracks here and there that pop in. Or there's some people that really do very well with work, but it's this home stuff that really sort of plays a bigger role.
yeah. Well, and I think that's it too. Is I wonder too how much it affects relationships. Because someone with ADHD is probably very well intentioned, but they just forget to do these things that other people are expecting them to do. So I imagine there's a relationship.
Right. So there are definitely a lot of times where, what like let's say if I don't know the husband in a relationship has ADHD, then maybe the wife ends up being more of a caretaker and taking care of more of the more day-to-day stuff, or sometimes navigating, the husband's, I don't know, let's say medications or things he needs to do, and can't really rely on the
Yeah.
husband to do certain things, especially time sensitive stuff. That then, creates an uncomfortable dynamic in a lot of cases in a relationship.
What about gender differences with ADHD? I believe I've read places that it tends to be more prevalent in males. Is that true, or is that not true?
I mean, that was definitely the thought. I mean, in the past, I mean, I think in terms of statistics, it's certainly, I think it's become more well known that it is quite common in women as well. I'm not sure on the
Okay.
current statistics on that, but it, in terms of the exact, what's, what if it's closer to even at this point. But I guess in like statistics aside, I mean, in general, like for women, while it can definitely present someone differently, like it can often present as, less of the hyperactivity. I mean, certainly there are women with ADHD that have a lot of hyperactivity, but it can often
Hmm.
some common things are someone who's very talkative, someone who's sort of very
Hmm.
flighty and just kind of ditzy in a sense. There's sort of a lot of different sort of pieces to it, but it can impact social relationships. Um, women in terms of not being able to follow through on making plans or keeping plans. Um, I see it a lot sort of with, when women become sort of moms that, all the biological pieces with that can definitely impact, cognitive function, especially also if someone's not on their medication, normally, a lot of times people are not on medication while they're pregnant or breastfeeding, or
Hmm.
just, natural brain changes into the 30s and 40s. Sometimes
Yeah.
maybe they had it together when they were younger, suddenly hit 40 and it's, they can't really keep organizing quite the same way they were able to cope
Right.
before.
That's an interesting thing to look at too, though, when you talk about age, because I think for me, when I think of ADHD, the first thing that comes to mind is of course Mike Myers and Nicole Kidman in that SNL skit where finally I think they have him like basically chained to the playground equipment, and he finally goes so crazy he runs off and drags the playground equipment off with him. But we, think about it in the context of children. We always thought about it as something that children had. But something you said there was really interesting to me is the fact that like maybe you had it together in your 20s or when you were younger. But so this is something that brain changes can happen in older when you're older, and it maybe didn't affect you in the past, but it could in
Right. So
at an
there, I
older
mean,
age.
there's the brain piece of it, but there's also the fact that the responsibilities are different. It's one thing when you're taking care of
Yeah.
just yourself. It's another
Right.
thing if you have kids and you're keeping track of multiple kids' schedules when they have, various activities, especially if you have, let's say you have more than two kids and only, two adults in the household. How do you keep track of, where you need to be in two places at once? There's all these
Yeah.
three places at once. Sometimes like those things just, make things even more taxing mentally to try to plan out.
Sure.
If you sort of gotten by before, it's basically throwing increased sort of responsibility with the planning and making it even harder.
Sure. My life was a lot
Gotcha. Yeah.
simpler at 25 than at 45, and people with teenage kids compounding it that much further. Do you think hormonal changes as we enter sort of middle age could have an impact here?
Yeah, no, I
Andropause,
think it definitely
perimenopause?
can. I mean, I know there's definitely been more studies with women that have definitely indicated that. I mean,
Sure.
presumably other men certainly could as well, but I think that as far as I can recall, I think I definitely, can recall some studies on the impact with women.
Well,
Hmm.
perimenopause is more
Interesting.
drastic than andropause, in any way. And speaking of the gender differences, I have heard or read that for many types of disorders or kind of neurodivergent symptoms, because of the ways that women are socialized, women are often more difficult to diagnose. And this has led to kind of a myth that these symptoms are more prevalent in men, but really they're just more difficult to diagnose in women. Has that been your experience?
Um, I think it's hard to say. Like, I think,
Okay.
there can definitely be certainly a lot of males where it can be hard to diagnose it because of other stuff that's going on. I think part of
Hmm.
it was, in the past, there was less of a thought of women having it as often, in terms of
Right.
that. And I think more of a chance that I think maybe anxiety was attributed to, or what was sort of actually ADHD and what was attributed to anxiety. Kind
That's
of
a
the
good point.
same way that I think, a long time ago, it wasn't really thought of as men having anxiety or as many mental health issues as, in more recent years has been clear is definitely very prominent in men as well.
Right. Right. Yeah,
Yeah.
100 years ago they called PTSD cowardice, right? They we've
Yeah.
we've
Yeah.
we've come a long way as far as that goes. Now
Yeah.
I know that you don't prescribe medication. If medication is indicated, you would refer to a psychiatrist. But do you mind if we at least talk a little bit about it? I think we would be remiss if we didn't mention the role of medications at all. So can you just tell us what role do they play in managing these symptoms, and maybe tell us a little bit about the stimulant versus the non-stimulant classes of medication?
Yeah, I mean, yeah. So obviously, as I said, I can't prescribe, so I can't give very formal
Right.
advice on medications. But what I can say is that for a lot of people, they can be a very helpful, part of a comprehensive treatment plan for ADHD. So stimulants are usually what are considered the first line of defense, like the first type medications that are often used. And so
Mhm.
basically, what they do is, they help kind of. I mean, they're called stimulants. Basically, people with ADHD are often understimulated, which means that they sort of don't really have enough stimulation to be able for certain tasks that are challenging and maybe boring to sort of get themselves to do it. So the stimulants, in a sense, kind of help give them extra stimulation to be able to sort of focus better. So the medication helps a lot with direct focus and with reducing hyperactivity and impulsivity. So kind of the trouble sitting still. So like those are probably sort of the biggest things medication helps with. And in turn, it can often make it easier to use a lot of strategies, but it's not going to magically give you the executive functioning skills.
Right.
So that's also where I think even with kids, there's often a focus on people put their kids on medication, but don't really think about the fact you still have to teach them and work with them on strategies. It's not just the medication,
Sure. It's not a magic pill.
right? And there are medications that help with focus that are not stimulants. I mean, those are often used like if someone has a lot of anxiety and depression as well. Sometimes those are used instead of stimulants. Sometimes they're used with stimulants. I believe. Sometimes people can't tolerate certain side effects of stimulants. So they're on other medications. And for some people, those other medications can work quite well. They usually don't have the same immediate effects. The stimulants usually you take them and you kind of know pretty much right away if it's working or not. Those
Ritalin.
most other medications a lot along those lines, can only take a few weeks to fully build up in your system, I think.
Right. So Ritalin
Okay.
would be the kind of flagship stimulant drug. Maybe there are others
Right,
now.
yeah. Ritalin and Adderall are kind of the two
Adderall.
Right,
great,
Adderall, that's the other.
yes, different
And
types
then
of
non-stimulants are you referring to like Wellbutrin? Is that
yeah, like
am I
certain
remembering that
medications that
correctly?
were that are used for ADHD indirectly, but also are used for other things too. Wellbutrin, Strattera, the variety of medications that are used in different ways, sometimes for ADHD, but also used for a lot of other things as well.
Mhm. What about side effects for these medications?
I mean, I think almost all medications can often have at least some side effects. I think it depends on the
Something.
person. I mean, probably the most common side effects or stimulants I'm aware of, certainly like appetite suppressant. So that can be challenging for people. Some
Sure,
people
sure.
feel like it's sort of changed their personality a little bit and they're not as, outgoing as they might be. Um, and again, but that's why it's also really important to work with a psychiatrist or other medical professional that can really help you find the right medication, find the right dosing. Because sometimes, if it's too high of a dose, you're sort of in a zombie in a sense, even if you can focus really
Right.
well. So you have to find that right balance to be able to function,
Yeah.
well and sort of be yourself at the same time.
Gotcha.
So, of course, you work from more of a therapy, obviously, because you can't prescribe drugs, as you've mentioned. So do you see this as would you say drugs are more kind of an escalation, maybe, of treatment? Do you recommend people start maybe with someone like you, and then what's the best approach, I guess, to go into this? It seems like, from my personal perspective, I would start with someone like you before I started taking drugs.
Sure. I mean, I think it depends on the severity of the current. I think it probably depends on the severity of the issues. Each situation is different. But in general, I think
Right.
trying to adjust everything behaviorally first is helpful because then you figure out what's left after that.
Yeah.
That, sort of if you really can't address all behaviorally, then look at medication. But again, I think with ADHD,
Gotcha.
there's definitely parts of it that, like the impulsivity and hyperactivity are a little bit harder to sort of, I mean, while you can target pieces of those, certainly behaviorally, I think those parts are certainly a little bit harder to fully target without medication. Like you can do your
Right.
best, but I think that, there's only so many strategies you can use in the moment and other things you can do to offset it that where, I mean, attention also can still be hard, but I think there's more things you can do with behavioral strategies for attention than I think for the other stuff.
Of course, you've mentioned the coping strategies, right? The apps, the and so forth. I myself find that if I haven't stuck to my workout routine, if I've missed a couple of runs, that my focus it tends to be more difficult to focus. I have more challenges with focus. Um, is exercise part of a therapy, part of a coping strategy?
Yeah, I mean, I think for a lot of people, it definitely can be because, I mean, here's the thing. There's a lot of things that are healthy for most people to do in general
Sure.
that, are probably, certainly healthy for the ADHD and probably even more important than for the average person, but are still very important for everyone. And so,
Mhm.
regular physical activity is definitely one of those where, a lot of
Right.
people with ADHD find that, getting a good workout in each day, sort of really helps to sort of offset stuff in terms of some of the fidgeting and, mentally can really help. I mean, one of the
Yeah.
things I like to sort of help people a lot with is I know you mentioned kind of getting up every 30 60 minutes, but also the idea of what you can do to get movement in while you're working. Because
Hmm.
one of the things that I like to call it the idea of harnessing fidgeting to improve focus. That if people naturally fidget whether with their hands or tap their feet, if you can sort of get movement in a controlled way and have it be mindless while you're working, that can also you can basically trick your mind into thinking you're more interested in something than you are, and in turn be better
Gotcha.
focused. So, for example, things like getting like a little desk elliptical, like this big, you can stick under your desk and pedal while you're working. That can be really
Mhm.
helpful. They make a bike and an elliptical version. I've tried the
Cool.
Stairmaster one as well. That one's a little bit harder to do sitting,
Yeah.
but
Yeah.
it's okay. And then you can do like a standing desk can be great because it gives you flexibility throughout the day with what you're doing. And for standing, using it like a mat or even a balance board can be great. Like there's a awesome thing called a whirly board where basically, or do you want me to show you it? I can show it to you if you want.
Yeah, I
Sure.
would
Yeah.
love to see it. Yeah.
This is a whirly board.
Oh,
Oh,
wow.
yeah.
It has so you really have to have like a mat or something with it, but basically you stand on it. And so what's great about it, and this is the wide board version, so it's meant to be stood on for longer periods of time. There's also a little ring you can stick underneath it, so you don't have to bounce quite as much on it if you don't want to. But that's great because it basically gives you a very subtle movement, but because you're using your feet, it's mindless. Because usually most people don't need their feet to work at a desk, but you're
Right.
often using your hands to type or use the mouse.
Yeah.
So that's one idea. This is also like more of like a rocking board.
Yeah.
Yeah. I use that similar to that whirly board. I use a very similar item for also rehabbing my bad ankle. So those are great.
Yeah, I think they've been helpful for a variety of things. I mean, other things that
Multi-use.
can be great are walking pad or kind of like an elliptical under the desk.
Sure.
Any or a wobble stool or a yoga ball chair. I mean, one thing that can be very helpful is to actually have like a bunch of stuff and just kind of rotate through it at different times of the day. So maybe
Yeah.
you have when you're responding to emails, use the treadmill, and maybe during meetings you use the elliptical or something like that. Because then this way it creates more of a set schedule to use these things and ensures you're getting movement in throughout the day. Because even if
Gotcha.
you have all this
Good.
stuff, if you're not aware of it, it may just sit there and you may just ignore it. So having a way of kind of remembering to use that stuff can be very helpful.
Yeah.
And anything else that can help that you want to mention? Slight sleep hygiene, mindfulness meditation, are any of these effective strategies in coping with these symptoms?
Yeah, I mean, certainly, I mean, sleep's definitely very important. And I mean, for a variety of things, not just ADHD. But yeah, I think
Everything,
really working
really.
on kind
Yeah.
of having a good wind down routine to get your mind sort of ready to be able to go to sleep. Looking at
Mhm.
also what time works best for you, with the idea that some people sort of have, like I know for me, for example, if I'm in bed by, by 10, I fall asleep really well and I sleep really well. If
Right.
I don't get to bed till let's say after 10:30, usually I have a harder time falling asleep and I tend to, toss and turn more during the night. So like,
Same.
knowing for yourself what time is there a certain like magical time that works better for, going to sleep is helpful. That paired with, figuring out how much sleep you need and what time you have to get up by. So I think, working on, having an evening wind down, using the iPhone, using your, if you're an iPhone, for example, using the
Yeah.
focus mode to turn stuff off. So it kind of signals to you, oh, it's time to get ready for bed. I need to start winding down. So that can be very helpful. I mean, you can set up stuff to block, certain apps if they're too tempting to use at late at night. Using, like a bedtime meditation can be helpful to kind of, ease into sleep. One of the things that can be challenging with meditation and mindfulness is for some of the ADHD, it can be very hard to sort of stick with them because you have a hard time focusing. So, I mean, my
Right.
suggestion for those is to really try to do very short ones, like a couple minute ones, because I think trying to do a 15 or 20-minute one can probably be very challenging. I mean, for anyone to start,
Sure.
that can be hard, but I think especially with having a hard time focusing, having to do a really long one can be challenging. And some, if you look on, Headspace or the Calm app, there are some that have like some sort of visual component. So those can also be helpful, especially during the day, because it gives you something visually
Yeah.
to focus on while you're listening. But even having like like a 2-minute meditation break during the day where you basically have it, use a preset thing on an app and, you have in your calendar, I don't know, at 3 p.m., you take 2 minutes or 5 minutes, you close your eyes, you play the meditation or play calming music, and then you go back to the rest of your workday. Like something like that, if you can carve it in, like that can be very helpful.
That's great. And I'm sure, as with anything, these things get easier as you practice them. Speaking of
Exactly.
time blindness, I am growing mindful of your time, Dr. Heller, and I do appreciate you speaking with us. Could you tell us if our listeners want to connect with you, where they can find you?
Sure, absolutely. So you can reach me. My practice website is hellerpsychologygroup.com. As a psychologist, I can see people in 42 states.
Oh, wow.
So I can certainly work with people in a lot of states. I do an executive functioning boot camp. It's basically a 2-hour, one-time session that's geared towards helping people really, it's fully customized. So it's working on pretty much all the stuff we talked about today. And, I'm sure other things as well to really help you to kind of come away with a clear plan of what you want to work on.
Mhm.
And also set up the tools during the session to be able to, start hit the ground running with work with implementing these things to make things better. They also can find me if they want tips and strategies. I'm pretty active in social media, either on Instagram, Carey Heller PsyD, or also my practice Heller Psych on Instagram. Post a fair amount of the stuff that I produce as well.
That's great.
We also there's also a YouTube channel, Heller Psychology, that produces a fair amount of videos that I make and, other resources and stuff as well. So those would probably be the main places to find me.
Right. And of course,
Excellent.
we'll have all those listed in the show notes as well, so folks can find you there. And I guess
Yep.
we should also mention that as you're listening to this, it is ADHD Awareness Month. So
That's right. The month of
it's a
October.
perfect time.
Yeah, that's a good timing.
So find those show notes at fitafter40.substack.com. Dr. Hiller, thank you so much for taking the time to speak with us. This has been really interesting, and I think it's been helpful for me, so hopefully some of our listeners as well.
Yeah, absolutely.
You're very welcome. Thanks all for having me.
Thank you for listening. Please make sure to like or subscribe on Apple, Spotify, or wherever you get your podcasts. We also list the show notes and have lots of bonus content available on Substack or Instagram.